Hello and welcome to Unbossed, Unbothered, and Unfiltered. I'm your host, Lauren Zayu. Join me as we navigate the political communications, ups and downs, and ins and outs of our day. We're talking to leading experts on the issues that help our country move forward for the better. My guests and I promise to give you the history, the real, and the ideal. Let's dive in. Hello and welcome to Unbossed, Unbothered, and Unfiltered. I'm your host, Lauren Zayu. This week, a Facebook whistleblower revealed that Facebook has internal data that reveals they know how responsible the platform is for disseminating hate and misinformation, but decide not to curtail it because it increases engagement, which increases ad revenue. There was also data that showed the detrimental impact that Instagram is having on our youth, particularly the self-esteem of teenage girls. The next day, Facebook, Instagram, and WhatsApp went down across the world, and it became abundantly clear how integral these communications functions are for our world. Misinformation about COVID-19 and vaccinations has spread rapidly, and Facebook has been a major player in that. This episode, we're talking with Beth Tadesse about how that misinformation has impacted her work. Beth is currently the Operations Section Chief for the COVID-19 Vaccine Operations Center at the Chicago Department of Public Health. While she currently works in public health emergency preparedness and response, she has a background in reproductive health, where she coordinated bringing STI screenings and reproductive health education to adolescents in schools across Chicago's west and south sides while working for Planned Parenthood. In addition, Beth worked for the Washington, D.C. Department of Health as a public health analyst, working to ensure low-income HIV-positive persons had access to HIV medications and comprehensive health care. Beth earned both her Bachelor of Science and Master's degrees in Public Health from Tulane University in New Orleans, Louisiana. Her moves across public health spaces have varied, but she's always been committed to health equity in every role she's served. In addition to her expansive bio, Beth is a dear friend. I'm so excited to have her on, and I know that the information she's got for us today will be exceptional. I'm excited to welcome to Unbossed, Unbothered, and Unfiltered, Beth Tadesse. Hi, Beth.
Hey, girl.
And how are you today?
I'm good. I'm hanging in there. It's a crazy world, but I'm hanging in there. It's good to see you. I'm glad to have this conversation today.
Oh, thank you. So why don't we just tell the people a little bit about your background? I mean, needless to say, I've known you for a while, but let's familiarize the viewers and listeners.
Sure, no problem. My name is Beth Tadesse. I'm currently the Operations Section Chief for Vaccine Operations Center here in Chicago for the Department of Public Health. What that means is pretty much we have different operations around the city of Chicago to bring vaccine access to the residents. So whether it is a mobile pop-up event, we have, I think, 13 going on this weekend alone. We bring vaccine to your home, and we also have an outreach team that goes door to door. Prior to this, I did work at Planned Parenthood for a couple years in reproductive health, really focusing on adolescent reproductive health. So bringing STI tests and treatment directly to young people where they're at. So we were in schools, we went to detention centers, we were at community organizations for a long time. Prior to that, where I knew Lauren is in DC. So I used to work for the health department there, and also for a couple different community organizations, primarily working around HIV medication access, also getting comprehensive health care to low-income HIV-positive persons. And prior to that, I used to live in New Orleans. That's where I got my undergrad and my graduate degree there in public health. And I also worked on school to prison pipeline crisis that's happening there. So been around lots of different things, but in each of those different public health spaces, really what's kind of driven me is just health equity. So whether it's working in STIs, COVID, or around advocating for adolescents to have a safe and healthy school environment, that's kind of what's driven me throughout. But that's where I am. That's who I am.
I appreciate that, and I definitely appreciate your work. And as far as today and your work today, it's vaccination access and I guess making sure that people have what they need information-wise as well. I feel like we've heard a lot of different things about COVID from like like the initial vaccination timeline people felt was skewed, and then the actual vaccination happening, but then we hear about these breakthrough cases and different variants. So can you kind of break down what all of that means for your space?
Yeah, definitely. So there's a lot of different things that we monitor when it comes to COVID. So I'll kind of just like do a quick explainer on like what kind of these different terms mean, because I think a lot of times people see them on social, people see them through their different networks. So let's talk first about vaccine coverage. So a lot of times what we're covering to see, are we doing a good job in terms of getting vaccine to folks, is we're looking at something called a vaccine coverage rate, vaccine rate, whatever you want to call it. So we're just looking at the data to see for a particular person, resident, whoever it is, how many of this particular population do we believe, it's an estimate, have been vaccinated. And actually a lot of our data is really sophisticated. Here in Chicago, we can get it down to the census tract. So I can look block by block and see what we estimate folks to be vaccinated at, whether it's a first dose, if we're talking Pfizer, Moderna, or it's a complete series and just like Johnson and Johnson. So that's kind of how we're looking at the data and how we kind of focus our strategy, especially from an equity perspective, is like, okay, where are we really lagging behind? Where do we need to redirect resources, whether it's show up at a pop-up at a laundromat that's in, Little Village in Chicago, or if we need to show up at a block party that's going on in Woodlawn, Chicago, where I'm at, we kind of tailor that way. So those are the rates that we're kind of looking at. There's a lot in the news about variants, so I'll do kind of a really quick high level over those. There's a lot of different terms with variants. So I don't know if folks are probably familiar with something called a VOC or a variant of concern, but there's actually something even before that. There's something called a VOI, or a variant of interest. Really what that means is that we've detected that there's a variant of this virus that's come out, and again, variants, mutants are not uncommon. We can have thousands of different variants that happen. And a lot of times it really doesn't affect how the virus is operating, even if it mutates just a little bit. But when it's a variant of interest, we've noticed that there's some marker in there that maybe this is something that has characteristics showing that it could lead to increased transmissibility, or it's likely to spread more, or more likely it has a marker that's showing that potentially these things have been associated with severe illness. So we're just going to keep an eye on it, but nothing really too much to worry about there. And currently in the US, there aren't any variants of interest right now. So rest easy. Variants of concern. So that's like, we've now moved from interested to we're a little concerned, because we've shown that there's some data showing us that, okay, there is either it's the increased transmissibility, or and potentially that it is not only spread easier, but it's causing more severe outcomes, hospitalizations, deaths. There is one currently, Delta, that's out there. That's a variant of concern right now, right? And then even beyond that, so there's kind of like a third level to all of this. We call them variants of high consequence. So these are, not only do we believe, and we've seen some data, it is clear evidence that all of our kind of countermeasures, preventative measures, are less effective, right, than in treating this particular vaccine. And thankfully, right now, we don't have any variants of high concern, hopefully. But when you see these different names, I see them quite often, come across my feed and things, oh, there's a new variant. Don't be too alarmed. Really look at like what the source is, what the data is showing us, because just because we have a variant, that's not necessarily something to be alarmed at. So that's that little piece that's there. So those are kind of the key kind of things to look out for.
Absolutely. And that, I mean, even hearing you say it in those terms makes it sound less scary, right? Because the original concern with breakthrough cases, particularly for people who were already vaccine skeptical, was like, oh, y'all told me to get this vaccine. And then like even y'all who got it are still ending up in the same space.
Yeah.
And so what happens there?
Yeah. So let's break down a breakthrough case. So what that means is someone that has been fully vaccinated. So they've received their primary series. So if it's Pfizer, Moderna, their first and second dose, Johnson & Johnson or Janssen, they've had their first dose. So they're considered vaccinated, and it's been 2 weeks post, right? Their body's had a chance to really build that immunity. So we consider them fully vaccinated at that point. A breakthrough case is when those people then do get COVID. But keep in mind, while it's definitely something we want to prevent, no vaccine that's out there is 100% effective against getting COVID-19 or getting any sort of virus that's out there. It is highly effective. The vaccines that we have are super effective, but it's not going to be 100%. The good news with that is that all the data that we're seeing currently right now is that even for those breakthrough cases, many of them have one shorter time that they're considered contagious. Okay, so potentially you're even less likely to spread it because there's less time that you're considered infectious to other people. But more importantly, the thing that I'm most concerned about is those severe hospitalizations, people getting really sick or dying, right? And if you are vaccinated, the chances of you getting those severe hospitalizations is dramatically decreased. So a lot of times what we're seeing in the news is, yeah, there's some breakthrough cases, but among the people who are truly ending up in the hospital, they're being ventilated or they're dying, 97% of them are unvaccinated folks. So truly, really look at the data, weigh it, against your decisions, because being vaccinated is your best kind of armor against this thing.
That sounds like a great, I guess, stat to have readily available, and also understanding of what's going on. And as we transition into Hold Up, where we discuss like something that's kind of missing from the conversation, I've been wondering, like, so much of the conversation around COVID misinformation has come from what people are calling like bad sources or bad data. Like, can you give me some examples of some of the bad sources you're seeing out there, and if there's any central point to all of that?
So I think a lot of times what I'm hearing, so we do have, I like to just talk to people. What are you hearing, typically? Because being in the public health space, a lot of my feed is the really accurate information, and I do actively seek out to get that information to me. I'm not trying to see all the misinformation coming across. So I have to talk to folks. So we do have outreach teams. We do poll people, throughout Chicago, because that's where I am right now, about what are you hearing if you're not vaccinated? What are you concerned about? So I hear all types of stuff. I hear, the latest one I heard is, if you get vaccinated, you can stick a spoon to somebody and it will automatically, just
like make you magnetic?
Catch them. Yeah. I think the OG of them, I've heard the chip situation, which is also just like not true, right? And then another thing that I'm hearing is a lot of folks are just worried about long term, if they get this vaccine, what are the effects that are going to happen? And right now, like I've kind of said already, it's showing the data, the research is showing us it is super safe, super effective. If anything, I'm seeing a lot of the data around long-term or kind of that post-condition of COVID for people. And that to me is really scary. So whether it is sustained kind of shortness of breath, fatigue that people are feeling many months after contracting COVID, and sustained, loss of taste or smell, and death, like you could die, like you really can die. So I think really trying to, like, if you're hearing things, for me, it's go to your sources of truth. So in Chicago, our kind of top doc, Commissioner Arwady, who's my boss, hosts these kind of 2 times a week, every Tuesday and Thursday, just gets on Facebook, talks to the public, and answers questions directly from people so that, hey, what are you hearing? Let's talk about it. I do think that innately people are trying to make the best decision for themselves all the time. And, you're surrounded by your circle and your sphere. But I think, what we need to do is really start to kind of like have conversations, push people to have trusted messengers. So whether that's your own healthcare provider, whether it is the CDC or the FDA or your local health department, talk to those folks. And something else that we're really trying to do is empower people with the right information. So we have in Chicago, we partnered with our local college to develop a free course. hey, take this course yourself and you can become a vaccine ambassador within your family, your friends, and it's going to feed you all the right information. It's going to show you how to have really challenging conversations with folks, but really trying to just kind of get at the source of it. But yeah, I hear all types of kind of wacky stuff. I try not to judge people too. I think we need to be really compassionate. Just getting back to that, people are doing the best that they can kind of thing, and shaming people, making people feel bad that maybe have waited this long is not going to get us anywhere. We really need to approach this in a way of, okay, what are you concerned about? Let's talk about it, and try and move you to the other side if you're willing to go there. At least get you the resources to be able to do it.
I definitely think that's the right approach. And I do think one of the things that we're also seeing with this virus, or it feels like, is a bit of like science and communication happening in real time. Mm-hmm. And so I think people are frustrated because they feel like they're receiving mixed messages at times. When in reality, like, as you said, everyone is doing the best they can, and like people are presenting the best information they have available. And in the event that that information changes, it doesn't mean that there is any malice or, I guess, like that anything is being hidden from you. It's the information changed, and now we're presenting you with the most accurate information we have. Right. I also think that it has been interesting to see public figures speak out in their various ways. I mean, I'm sure you heard about Nicki Minaj and her friend of a cousin thing, and I don't even want to get into reading the story.
I saw a headline. It was very strange.
Yeah, and we'll leave it at very strange, because it definitely was. But moments like that, I think, are common across history, as far as people, one, being a bit potentially being a bit misleading with the situation. So like not wanting in an effort to give a true case for something, citing something people are already skeptical of. Mm-hmm. And people do cling to information from influencers, right? We know that people believe public figures for better or for worse, even in areas outside of their expertise. Right. And so it's been, I think, as frustrating as it has been, I do think it's somewhat like accurate for the American condition, as far as like looking across history at the way moments like this have happened. Something I did want to know, though, is you mentioned about speaking to sources, or speaking to your trusted sources. Are there sources that you recommend following for the most accurate information?
Yeah, most definitely. I really do lean towards getting as close to the data as you can. So if you are someone, I know this isn't for everybody. I'm a public health nerd, so like I'm going to look at what the data looks like. I'm gonna look at it myself. So a lot of this data you kind of pointed to, like we're learning in real time, for better or for worse, kind of like on what to do. And sometimes it changes, and that can be frustrating for people. But I do appreciate kind of the transparency that's going on with it, so that people can make a decision that's for themselves. So a lot of the data, when it becomes available, is out there to access. So you can go to WHO's website. You can go to CDC's website, and they have nice summaries of information, so that you're not reading like really like the peer-reviewed kind of in the weeds kind of numbers. You can still get it from that trusted source and get kind of the key takeaways for it. So those are some, local health departments are often releasing information as well. So I think those are really good places to kind of go ahead and get your sources of information that are there.
Yeah, I definitely think government offices are some of the places with the most accurate and most timely information in times like this.
Unfortunately, I will add, a lot of this weirdly has become very political. A lot of this, like around whether it's a mask mandate or needing to implement other public health measures, a quarantine or anything like that. So I think it can get kind of a little dicey at times. And it's kind of been a divisive topic, weirdly, public health during the last few months, 19 months that we've had this. So again, like, look to your public office, but also look at the data that they're referencing for yourself, just to be sure, because there's some interesting things that get out at times, depending on which office you're looking at.
Understood. And kind of thinking about your background in public health and like working with, I guess, others more accurately, COVID-19 appears to be the first in a while of pandemics, I guess, to impact the entire population. I know that initially people, there were certain sects who were thought couldn't get it or wouldn't be impacted. And now it's become clear that anyone can indeed get COVID-19. But your work previously with HIV positive populations and like other groups who are impacted by disease, have you noticed a difference in like this communication style versus like when you've worked with other demographics, if that question makes sense?
That's a really good question. I think, if anything, what we're doing this time, I think it's changing as well. Okay, so first, getting the message out to everybody definitely is something that's different, because a lot of times when I was working in HIV, there are certain populations just much more likely to get and acquire that infection. So really trying to focus on that. I think right now where we're at with the pandemic, yes, everybody can get it, but we are seeing those clear lines of these are certain populations that are much more likely at this point to get the infection. Not on any fault of their own. There's a lot of other factors that are there. It doesn't have to do with somebody's race. It doesn't have to do with somebody's gender, anything like that. It's the positions that they're in that kind of make them more vulnerable. So whether they are working in an industry where they have more exposure to people, right? So really trying to tailor your message to those people. So I am seeing right now kind of what I've seen in other infections, other different work where it was much more tailored messaging starting to happen now, especially as we see clearly, especially here in Chicago, the pockets of the city that are less vaccinated and have higher, unfortunately, like poor outcomes right now as it relates to COVID. So we're definitely at the health department trying to zero in, tailor our approach to those particular populations to make sure that our message is getting across to them how important it is for their community to be able to get vaccinated. So I think we're in kind of like a different kind of space, in my opinion. We're starting to change right now, because it's quite interesting. In parts of the city, we have upwards of 80% vaccinated, which is fantastic. But we also live in other communities like the one that I live in where it's 50%. And also this is the same community where folks are much likely to be sicker, much likely to die because of all these other factors. So really trying to narrow in where can we make the most amount of gains and progress. So yeah, that's kind of where I see that we've landed.
Yeah, and I definitely think the tailored messaging we're seeing, at least, on my end, right? So coming through Twitter, right? I remember when Juvenile dropped Vax That Ass Up, right? And Vax That Thing Up, sorry. And I laughed from my soul the moment that I saw it, right? Because I'm like, I know what we're trying to do here, right? We are tailoring our message to people who may be a bit more inclined to receive it this way, for better or for worse, however you feel about like campaigns like that. But it is like, I think as someone who specializes in communications, like watching that happen in real time, because even I remember when they were kind of gearing it towards young people, but in a way to have empathy for their elders, right? It was like, these are your grandparents, these are, your neighbors, like don't just essentially be reckless. And so I do think we have been shifting our message to particular populations across the times. And I do think that that's important to do, particularly because it appears as though, from my perspective, that the plan is to get as many people vaccinated as possible. That's just kind of like plan A through Z. And I don't know, like, I do think it's unfortunate that it's become as political as it has, because it's similar to, maybe it was about this time last year, like wearing masks, where like a mask felt originally like a fairly small, insignificance, but overall okay. And I believe maybe in like just after what felt like the summer of civil unrest with 2020, like we had these like Karen protests and people are lighting masks on fire and all these other things that made it like, it just felt different. And so now I think we've done something similar with vaccinations, where the people I do know who are not vaccinated at this point, it also is becoming like, a point of almost pride, like even through everything, like I still
Mhm.
haven't,
Mhm.
without, I think, actually checking in with the initial reasoning for it and if that reason is still the same. I mean, within reason, I think that government skepticism is warranted in particular communities, and so
Yeah.
I get it.
Yeah.
But I also think that everyone should have their own line as far as like, okay, I at some point you're going to have to come to the table. And
Mhm.
what we want you to come as quickly as possible, and so what's the
Okay.
best way that we do that?
Yes, agreed. And again, I think it's so many different things that need to come into play right now, and that's why I think we're trying to refocus on, it's not an access issue.
Mhm.
Unfortunately, now we're at a point where vaccines are going to waste, in this country. There's parts of the
Mhm.
world that don't have the access that we kind of take for granted to a certain extent.
Mhm.
So I think trying to change our approach to, yes, we will increase access for all the things that I mentioned. We have a program here, I think I mentioned at the top of the call, like we will literally come to your house, like anywhere in Chicago. Like you can call us and we will make sure there's a provider there within a week to two to just to
Mhm.
vaccinate you. And we'll pay you $100 to be able to do it. So like that's an opportunity available to everybody. There are also these mobile pop-ups where, like I said, we show up on all these different blocks, all these different organizations. If you got a party, invite us, please. Like, we'll come and do it. But while that's there and readily available, I really do think we are at a point, kind of like you're saying, where we really need to talk to people about what are you hesitant about? What are you reluctant about? I think one thing that's kind of missing from the conversation is I really don't believe that there are a big number of people who are like, no way, like, I'm
Right.
not getting the vaccine or I'm waiting till an employer mandate to get it. There's definitely those people, but I think it's far less than we actually realize.
Mhm.
And through our polling, talking to our outreach team that's out there, talking to folks that they're knocking on their doors, talking to about getting a vaccine, we've noticed that reflects what we kind of assume. There's a lot of people who are like, I actually just have some questions. Like I need to
Mm.
talk to somebody face to face, someone from my community
Yeah.
who's knowledgeable on this to get to that place. We work with a lot of our faith communities to where, we'll have testimonials like within churches and mosques and things like that before we
Mm.
have a vaccine event. So you can hear from someone who you sit next to every Friday, Saturday, or Bible study, whenever you have service and come together and you feel confident. They're holding your hand and reassuring you that it's going to be okay. So I really do think we need to do a lot more work in meeting people where they're at, talking to them about what they're concerned about, to be able to increase our vaccination rates at this point. Because I think there's a lot more people who really are much more on the fence than we maybe anticipate or assume.
Yeah. I think it's important to believe in people.
Yeah.
I do, and it's actually funny as I say that to transition into I ain't sorry, where we develop like our or we talk about like a personal or professional philosophy that you do in your work that makes you or that one you refuse to apologize for and helps you do the work that you do. If you don't mind, I'll go first. And like for mine, it's honestly that I do not apologize for believing in people.
Yeah.
Like, despite what it all says, everything from election rates to the way campaigns go to even like interaction with people who profess to be allies. Like,
Mhm.
I will continuously believe in the better side of people and the betterment of people. And I think to give up on that is actually when we start to really lose society as a whole.
Right.
But Miss Tadessa, what would be yours?
I think I have probably one thing is that kind of carries me through. I'm not really sorry about is I am not in the business of telling people that they're wrong. And I
Mm.
think a lot of our conversation has kind of gotten to this in so many words, but I really try to approach whether it's I'm talking to a young person about why it's important for them to get tested for STIs, or I'm talking to someone about COVID vaccine and why that's important for them and their community and maybe the older person that lives with them. We have to look at people as a whole person.
Mhm.
People don't make decisions in a vacuum, and so really whatever type of work decision I'm making, really trying to get curious and try and understand why people are making the decision that they're making and just present people with the facts. I think,
Mm.
we've talked a lot about misinformation that's out there that's circulating. I really try to just empower people. This is what the data is that we know right now. Let's talk about this, what this means for you, what this could mean for you in the future. And then from there, we'll talk about, okay, if you're interested, let's talk about getting you access to it in whichever way makes sense for you. But you have to come into the conversation not with the mindset of I'm right, you're wrong. Like you
Mm.
can't lead with that. It has to be, let me understand where you're coming from. Let me tell you what I know. You tell me what you know. And then let's take it from there. So every conversation I have around, whatever behavior, whatever health outcome we're trying to achieve, let's start there. And if you're not going to do it, okay, fine, that's fine. But I really think that that's something that a lot more people, organizations probably need to approach the communities that they're working in with. And I can only speak from the health department because that's, where I currently work. But something that I really try to push is, hey, let community lead. Like we are the
Mm.
agency, have a lot of the tools. We are privileged in having the resources. But let's let them tell us what it is that they need to be able to get there. And then from there, we can move forward. And so here in Chicago, we have something called Healthy Chicago Equity Zones, where we literally fund regional leads. So we split the city up into different areas, and those regional leads, community organizations, then in turn fund community organizations that are at a more granular level that really
Mm.
know these census blocks that we're talking about, and they tell us the support that they need. And I think that's the best way to kind of move it forward because it will be in a more tailored, intimate kind of approach where people feel empowered. And again, who are we to say that we know exactly what works? Things aren't working. Health equities have not moved quite
Mm.
a bit over time. The same populations, for the most part, are just where they're at. So I think we really need to reframe how we think we're supporting communities and people to empower them to make the decisions that are best for themselves to move forward. So that's
Let
something that
community
I
lead.
apologize for. Mm-hmm.
I love it. I love it. I love it. I think that's a fantastic model and mantra, particularly for moments like this as well. Communities, particularly communities that look like us, have been crying out for years, like, we know what we need. And
Yeah.
if we need anything from you, it's money in order to adequately like take care of ourselves.
Right.
And that's a very real thing. Keeping that in mind as well, though, what, if anything, is giving you hope for the future right now?
Ooh. I think in that same kind of vein, like this Healthy Chicago Equity Zones is like an example. I'm seeing more people coming around to the idea of putting resources, putting your mouth where you're putting money where your mouth is for this sort of thing. Like, we really are, I think, starting to move away from let's kind of a lot of emphasis on like let's study and research these health equities, which is really important still. You have to monitor it, but you can't change anything just with data. The key is really in the implementation. So what are we actually doing? We know what the disparities are. We know where we're lacking. We know a lot of these communities that are hardest hit by whether it's COVID or diabetes or heart disease or anything like that, breast cancer, are the same communities for the most part. Bring them what they need. They've been disinvested over time. Invest in them. And you will
Mm.
see, I believe, the changes that we're wishing to impart. So less kind of talk, more sort of action is kind of where I'm always pushing people and organizations that I work on. And I'm starting to see a lot more of that happening, even at a very local scale here in Chicago. So that gives me hope. We're not so stuck in our ways. I think we really are starting to move the needle on these things. And I appreciate to a certain extent, even though a lot of these different platforms can spread misinformation, it's also an opportunity for people to really speak up and be heard. And so I think that helps people advocate for what they need, and provides another opportunity for those of us that are in positions to make decisions for these communities, the power and the resource and what we need. So that gives me a little bit of hope.
Absolutely. I'm glad to hear it. Did you have any final thoughts you wanted to kind of wrap up your time with today?
Ooh, I don't think so. I think this was a lovely conversation. I think for me, the one message really to everybody is, the same thing that we've known from the beginning. Do what you can. I know it's boring to have to say over and over again, like wear your mask, wash your hands, get vaccinated. It's been a long, almost 2 years. Like I think about COVID-19, that was 2019. It's almost 2022.
Yeah.
Yeah, this is a long one, but keep with it. Like stay the course, and we'll get there. Like we're seeing already a lot of progress. We weren't in the same place that we were last year, and so I think it's easy to get really negative. And we're still, COVID is still here, and it may be here for a while, but we've made a lot of progress. So stay encouraged by that, and keep doing what you're doing, because it really, really does make an impact.
Absolutely. Beth, I love you. I've loved this conversation. And in the event that our listeners and viewers want to hear more from you, what's the best way they do that?
So you can't. I hate to be the one, but something that also keeps me going is boundaries, y'all. So unless you're family or friends, you can't get in touch with me. You can't send me an email. I will give y'all my work email, and Lauren can put in the show notes. But no, I gotta have boundaries.
I fully support it. I support boundaries over here. Look, ain't nothing wrong with that. Give me one moment to wrap this show. You just finished this episode of Unbossed, Unbothered, and Unfiltered. If you're looking for me, you can find me at @LaurenZayu on Twitter and Instagram. And if you're looking for the show, you can find us at Unbossed, Unbothered, and Unfiltered on Facebook and Instagram. Thank you for joining us.